Well, today's August 16th, 2015, and for the viewers of the YouTube channel, this is a little bit different setting than usual. I'm here with a very lovely lady, Dr. Toni Mann, who's a dentist, and someone that you're very familiar with, her husband, Silvano Sen, who's also a dentist. And instead of the video being about Silvano today and what we do with dentistry, it's really about Toni and what's happened with her over 24 years with cancer, right? 24 years. So a quick summary, Toni discovered a cancer in her female organs around 1991, is that correct?
90.
1990. And you had surgery?
Yes.
And everything was cleaned out, right?
Yes.
And then you thought you had done well until when?
2007, I believe. Yeah, 2007.
And what happened then?
I did a CA 125 and it came back high, elevated.
Elevated. And since 2007, it's now 2015, for 8 years, you've been struggling with a tumor marker that's been rising.
Right.
And the viewers should know that you actually went and had low-dose chemotherapy, insulin potentiation therapy with somebody I highly respect, who's in Reno, Nevada.
Yes.
And that was an attempt to try and cure this thing with an advanced form of chemotherapy. And what happened to you getting a 10, what was it, a 10 or 20% dose?
A tenth of a dose.
A tenth of a dose of chemotherapy. What happened?
It scrambled my brain.
You want to comment on what happened to her?
It more than scrambled her brain, it annihilated her brain. She was not available mentally at all. There was like no mental there at all. And her personality, which is the reason I married her, she's one high-strung filly, was totally devoid. It's okay. That is okay. She knows that.
I can attest to it as well as friends.
Yes,
okay?
friends, yes.
The viewers here should know that we're friends. In fact, we're so much friends. This high-strung filly just...
Oh, no, don't do that! No.
just threw some water on your pants.
Because I said my wife should be lower than me, as she's sitting on a lower stool, and that's all it took. She just came apart, which is fine. I love it. I would not have it any other way.
That's good. Humor is everything, you know? So I remember this time, and this was only, what, about a year and a half or 2 years ago?
A year and a half ago.
And her brain, I noticed her brain was fried. She couldn't remember things. And that's when you came back to us. Is that correct?
Correct.
And what did we do for you?
You put me on Oracell.
And did you get oxidation therapy?
And ozone IVs. Yeah, I had a series of ozone IVs and Oracell.
And what happened to you after we changed the program and got you on ozone? And
well, my numbers are decreasing now. So.
And they're continuing to decrease,
yes.
Right?
Well, it was Oracell, ozone, and GC-MAF.
And GC-MAF. Those were the big three for you. And when we first saw you, what were your numbers?
Oh, you mean after the IPT?
Yeah.
Okay. Well, when I started the IPT the year before, my CA 125 was 55. And a year later, on my birthday, I had a CA 125 and my number was 55. And the physician that I was seeing in Nevada wanted me to start IPT again. And I wasn't interested. So
the IPT, in spite of the chemo brain, the IPT didn't do much for you?
No.
Okay. And once again, I respect that clinic greatly.
Yeah, it just didn't work for me.
Right, and I have sent them patients who need that form of therapy.
Yeah, it just didn't work for me.
The viewer should really know that.
And Oracell doesn't work for everybody either.
Nothing works for everybody.
Yeah.
Ozone doesn't work for everybody.
It's just,
and GC-MAF doesn't work for everybody. But there's been a lot of things swirling right now on GC-MAF out in the world. And there's been a clinic raided, and a clinic was raided over GC-MAF. You didn't know that. Now,
In this country?
In this country.
Oh, okay.
Yeah, the FDA raided a clinic over GC-MAF. And I don't sell GC-MAF. So I'm not running afoul of anything. And anybody it is legal for anybody
To purchase.
on their own to purchase something overseas for their own personal use. And that's what you're doing. And it's working for you, and actually it's working for a few other of my patients too, or it seems to be working. So in terms of quality of your life, since you went on ozone, GC-MAF, and Oracel, which is salicinium, how's the quality of your life been?
I am back to functioning pretty normally. It was not just the Oracel and GC-MAF and ozone. It was also diet. I think diet had as big a part in it to restore as the cancer treatment did in reducing my numbers. So it's, it's everything.
It's a
all.
combination.
Yeah.
In other words, it's your whole life.
Exactly.
You are living your life, and this is what I tell my patients. I've told you this too, and correct me if I'm wrong. You have cancer. You will be a cancer patient your whole life.
Yes.
It doesn't mean you're going to die of cancer.
It's just my issue.
Right.
Other people have schizophrenia to deal with.
Right. So, my goal is that you and your husband can maybe die doing something else when you're 85,
That is
right?
95. Come on
95.
now. Not
Okay.
85. Not 85.
Okay, that's the goal, because we're all going to die.
Yeah.
It's just a matter of how and when. So I have your permission to post this on YouTube.
Yes.
Is that correct? And
Yes.
yours too?
Yes.
What comments or advice would you give to somebody who faces a challenge of cancer? And come as your perspective as a health professional.
You need to be your own judge about your therapies, and you need to be your own advocate. And just because someone gives you dire news doesn't mean you have to buy it.
Any comments from you, Dr. Silvano?
I married a brilliant woman, and she has done tremendous in handling this disability in her life. Amazing, because we've been through more steps than you can believe, more dead ends than you can believe. And she took upon herself to study this and just kept trucking and moving on. And now we got it, at this point, it's under control, and we're having a great life. It's a great life.
That's important. The quality of your life is quite high.
Oh,
right?
very high right now.
And the quality of your life is very high, even though you're living a life knowing that you have cancer, it's under control, and you're eating right, you're getting the exercise that you need, and you're doing things to keep your immune system up. Is
Right.
that accurate?
Well, yeah, and also there's a spiritual component too that,
Thank you for raising that.
that's important.
Good.
It's part of the program.
Thanks. I think hopefully this will be of help to many people who see it.
I hope so.
I just want to add that the doctor you went to in Reno, who I consider a friend of mine, and all three of us and my wife highly respect, his name is James Forsyth. He's in Reno. He's an oncologist. The man is brilliant, and many of his patients have done very well. Here's a man who's a board-certified oncologist who's using low-dose chemo potentiated with insulin. It's called IPT. And it works well for a lot of people, but it didn't work for you.
Correct.
Because nothing works for everybody.
Correct.
So for the viewer who's interested in chemotherapy, all of us were in agreement, would suggest that
Absolutely.
you consider the low-dose chemotherapy with insulin.
Absolutely.
Because you should get much less toxicity with a 10% dose. In your case, you did get significant brain toxicity.
But that doesn't happen to everyone.
But it doesn't happen to everyone. And I'll also let the viewer know that your hair didn't fall out.
No.
And you didn't puke your guts out.
No.
like standard
No, it
chemo
actually,
doses.
as a therapy goes, it was very simple and easy. It just wasn't the right therapy for me.
Right. Okay. Thank you.